micro. Et le micro 1, je m'occupe, s'il te plaît, une personne sur un poste. D'accord? Je m'occupe du son, c'est la répartition qui a été choisie. J'ai pas besoin de toi ici, vraiment. Au contraire, même si tu as une bonne volonté, mais c'est dérangeant. Parce qu'après, ils ont plusieurs interlocuteurs. Et moi, je suis expérimentée, d'accord? Merci. Ça va, hein? Une personne. Tu m'entends bien? Où est le micro-main? Ah, le micro-main, donne-le-moi. On n'a pas le choix parce que sinon, on ne s'entend pas. Allez, hop, j'en prends un. Donc déjà, ça va pas. Il est où, s'il te plaît? Comment on allume le micro? Je sais que c'est en bas. Voilà, super. Alors, on va faire un test, juste un petit test de sonorisation. Est-ce que tu peux me confirmer par un geste de la main que tu m'entends, également sur Internet quand je parle comme ça? Est-ce que tu m'entends sur Internet? Tu ne m'entends pas. Est-ce que là, tu m'entends? Je dois mettre le micro ici? Qu'est-ce qui est en... Est-ce que maintenant tu m'entends? Là, tu m'entends. Est-ce que là, tu m'entends? Non, tu m'entends pas. Il faut que ce soit plus haut. Ah, il faut que ce soit ici. Il faut que ce soit en bas. D'accord.
Moi, je peux être
Ouais, faut le clipper. Voilà, donc on va faire comme ça.
Ouais.
Parce que sinon, ça va... Vas-y, on fait le test. Fais le test.
Mais avant qu'il parte.
On est là.
Mais le problème, c'est que vous avez une robe.
Oui, non, mais il y a des gens qui auront des robes.
Voilà.
Voilà. Est-ce que tu m'entends? Est-ce que tu peux me faire un geste pour me montrer que tu m'entends? Tout fonctionne, on a trouvé. Super.
Je dois le faire dans 2 secondes. Chaque personne. There will be a small
We're very happy to have you. Please walk all the way to the back.
I have no. Once I'm in there, I won't be able to move.
The lady on the Belgian.
Take one.
Sur la fille.
If you're talking, can I give it to you? Do you want us to have this in the live feed?
So, yeah,
or
so
no?
we- yeah,
No.
Okay.
They don't need to hear that.
Who are the first two people?
We'll keep that quiet. Then.
Exactly.
Who are the first two people?
Do you want a copy of this?
No, I can't be going to that.
No,
but is
no,
it
no.
possible
Someone,
to
I'll get one
put
for
it
you.
on-
We will find an assistant for that.
Can someone put this on the
Absolutely.
first two?
Yeah, I'll find
Actually, I don't need my phone anymore, so we can swap. You have this, and I take care of that.
No, I don't need your phone.
Yeah, I just need somewhere. Okay.
Ow, I can keep it.
Yeah.
It'll
Okay.
be there.
Yeah. Just put it somewhere safe. You know. Can you show me how you do it? Because actually, I've never really done it. But
Well,
I
if the
learned.
person has a jacket, I always clip it on the inside, and then it goes in their pocket, and you hide the cable.
Yeah, I know him.
Can you just tell me, for your video, do you need everybody, start to finish, or are there like 4 or 5 people? Okay, everything. I don't know who the. I have to ask someone who the first speaker is. I don't know.
Tu lui as mis le micro comme ça au moins on écoute ça.
I know, but I don't. She doesn't want it on
Ah,
her.
je doesn't want. Ok.
So I'm waiting to get the first 2 people. I'll put it on them. Over there, yeah. So. Oh my God. Yeah, for the start, you have.
You know, we have
Yeah,
this shot.
Person. Okay, it's good. You're on a cat. Person.
She said that there is nobody, no, someone told me there's never someone in the same time.
Okay. All right, and here I give it to Joseph. I know him. And Kira. Okay, I know these 2 people.
Because we got a room mic. Yes, but it means that they will have to. No, Jess.
Fernanda do Conselho Nacional. Tudo bem? Queremos fazer uma foto com você, podemos?
Sure. This it doesn't matter where it goes.
Sorry.
We'll go to the live feed. So can we put it on Valentina and on Rosanna? And then we'll get the.
Where's this one green?
They're 2 different kinds.
I cannot have 2. I mean, if I don't have like a colleague to help me with that, then how are you going to do the photo?
I'm hitting to
Yeah?
and then I'm
Okay,
but as long-
perfect.
can they be here?
Maybe we can try to record the She's a minister. Okay. This is a minister.
I have no idea how this is going to work. I have to hit record and the microphone. Oh la la. Oh, it's so popular, you know? Sorry, I'm going to be coming and going.
I can remember now. Will I see the attached the job to the first one? No, it would have been valid. If I had
Welcome to Moving from Principle to Action on Social Participation for UHC Health and Wellbeing. We're about to start 6:15 with the show. Because the delegation of Thailand is a traditional show. It's a surprise from the Thailand delegation.
I can hear you.
Can we please have some silence? I would ask for some silence, please, so that we can enjoy the show from Thailand delegation, the co-host of the event. Thank you very much. And I will give the floor to the Thai delegation. So they all are in the other part of their life working for the ministry of Thailand. Voilà.
สวัสดีค่ะ When I was young I listened to the radio waiting for my favorite song. When they play I sing along. It made me smile. Such happy times and so long ago. When they get to the part where he's breaking her heart, it can really make me cry, just like before. It's yesterday once more. Looking back on how it was in years gone by, and the good times that I had, makes today seem rather sad. So much has changed.
Okay, everybody sing together.
It was a song of love that I would sing to then, and I memorize each word. Those old melodies still sound so good to me as they melt the years away. Every sha-la-la-la, every woe still shines. Every sing-a-ling-a-ling that they're starting to sing so fine. All my best memories come back clearly to me. Some can even make me cry, just like before. It's yesterday once more. Thank you. ขอบคุณค่ะ
Here, I'm not in the program at the moment, but you see, if the Swiss law prohibits that you can use microphone when singing in the restaurant, what do you do if you are, social participation minded? You ask your friends to sing with you, and the lady here, with her voice, couldn't really fool this place, so she asked her friends to sing with her, and they improvised. So really, thank you so much. Thank you.
Thank you.
That's all right.
Microphone ขอบคุณค่ะ
Thank you so much.
May I take this from you?
From Thailand for a wonderful singing to welcome all of us into this space. I've just learned I didn't know when you are in a restaurant you don't sing with a microphone. They did a wonderful job. Let's clap for them. Thank you. Good evening, distinguished invited guests, honorable ministers, regional directors, senior officials. You are all welcome to this social participation event. We are delighted to have you to join this important side event on moving from principles to action on social participation for universal health coverage, health and well-being. We are joined this evening by a wonderful group of distinguished ministers, ambassadors, and officials from across the WHO regions. Your presence here today underscores the importance of our collective efforts and commitment towards advancing actions on social participation for the progress towards universal health coverage, health, and well-being. My name is Magda Rubalo. I'm one of the newly appointed co-chairs of UHC 2030, along with my esteemed colleague, Dr. Pamela Cipriano. Please come for her. It is an honor and a privilege to welcome you all this evening. We have a draft resolution on social participation for universal health coverage, health and well-being, which is being considered by member states at this 77th World Health Assembly, and tonight marks a point of celebration. The resolution is an important milestone and a testament to the hard work that has gone into progressing this vital agenda. It is also an opportunity for us to reflect on next steps, strengthening efforts, progressing implementation, and working together to inspire promotion of participatory governance in all health systems as an action towards progress for universal health coverage. UHC 2030 is one of the co-sponsors for tonight's event, along with our wonderful member state champions from Brazil, France, Norway, Slovenia, Thailand, Tunisia, and the United States of America. The Civil Society Engagement Mechanism for UHC 2030, European Observatory on Health Systems and Policies, and the UHC Partnership. UHC 2030 is a global, multi-stakeholder platform for accelerating sustainable progress towards universal health coverage. Our members include countries, civil society, the private sector, philanthropic institutions and foundations, UN agencies, and other international organizations. Our stakeholders are committed to working collectively on building equitable, resilient health systems that leave no one behind and provide the foundation for achieving health security. Ladies and gentlemen, currently more than half of the world's population lacks access to essential health services, and 2 billion people face financial hardship when accessing the health services they need. The African continent is 1.4 billion people. So if it is like all of us in Africa, plus some people from other countries, didn't have access to essential health services, just to give you an image of what it means. These are not just numbers. They represent the daily struggle of billions of people who are denied the right of health, the rights to health, well-being, and dignity. Remember, 2 billion people face financial hardship when accessing the health services they need. Social participation is critical to building equitable, resilient, and people-centered health systems, which place people at the center of policy decisions and programs. Social participation, to me, is what democracy is for our countries. Systematic participation and coordination of all stakeholders make health systems more transparent, more accountable, underpinning the social contract between the state and its citizens and building trust between governments and communities. Social participation in health is not a new concept and has played a critical role in combating health crises and improving people's health for decades. Social participation and community responses to HIV/AIDS was critical in leading cost-effective positive health outcomes and fostering community resilience. Social participation is essential for progress on universal health coverage, helping us to foster the implementation of appropriate context-specific policies, programs, and services tailored to each target population, especially for those in vulnerable and marginalized situations. Let me now take this opportunity to introduce the co-facilitators of the draft resolution on social participation, Slovenia and Thailand. I would like to extend our deepest gratitude on behalf of the UHC 2030 to both countries for their exceptional leadership and dedication in guiding this resolution. Their efforts have been instrumental in driving this important initiative forward. I would now like to call to the stage and introduce the Honorable Minister, Dr. Valentina Prevolnik-Rupel, the Slovenian Minister of Health. Please.
Can you hear me? Or oh, microphone. Oh, okay. Can you hear me now?
Perfect. Let me start with a warm welcome to all of you. It is a huge honor to address you at this gathering, which could not have happened at a better time. The theme of the World Health Assembly this year is All for Health, Health for All, we all know. After COVID pandemic and confronted with so many challenges and so few answers how to address them successfully, we all are looking for new innovative solutions. How can we be better prepared and responsive to climate change, the war crisis, the growing burden of non-communicable diseases and mental health diseases? How can we better address commercial determinants, misleading information on social media, and growing expectations of patients with limited health professionals? How can we make sure that health measures, services, and policies are available to the most vulnerable, often hidden or hard to reach populations? These are the questions awaiting answers. Something has always been there for us that, if recognized and supported, could bring us much, much closer to achieving our goals, in particular UHC. I'm speaking of all these highly motivated people who have organized themselves to serve society by helping those in need. I'm speaking of organized patients, the youth, volunteers in firefighting brigades, association of different professionals, or simply people who want to contribute to health and well-being and change the world for the better. They are ready to support us in ensuring health for all. They can contribute to more trust in health system. They can contribute to health literacy and can above all help us better understand and address the needs of those most in need. I'm speaking, of course, of social participation. My country does understand that social participation, while already there needs further investment to flourish. We have learned through examples of good practice and through the failures. Let me share two examples with you. 20 years ago, we started to develop a model of health promotion centers as a part of our primary healthcare system with multi-professional teams, including, for example, kinesiologists, dietitians, and psychologists. The aim was to serve the population free of charge with preventive services such as smoking cessation, brief intervention for alcohol drinking, physical activity support, nutrition counseling, and other preventive services. We also invested substantial resources in cancer screenings. After 10 years of implementation, we have realized that while the promotion centers had contributed to the awareness of healthy lifestyles in general population, those most vulnerable and hard to reach were still left behind. Attending the most were women in their early retirement who were already aware of the importance of healthy lifestyle. On the other hand, unemployed, persons with disability and mental health issues, specific ethnic groups, and those with less education and with economic hardships were not attending these free of charge preventive services. In organized colon cancer screening, the participation of men was low. Evaluation has uncovered the main barriers: lack of awareness and understanding, lack of trust, language barriers. Based on these findings and with the help of international funding and support, we have developed and piloted a new model based on community approach and social participation. Health promotion centers, while still providing lifestyle interventions, have acquired a new role in creating partnership with key stakeholders in local community, including civil society. Local health strategies and action plans were developed to address the needs of different population groups and identify and reduce health inequalities. Including various NGOs on equal terms in the teams enable us to better understand the concrete needs, adjust the programs accordingly, and improve access of vulnerable groups to health services. Participation of men in colon cancer screening has risen after the involvement of firefighters, promoting it man to man. The other example, the second example that makes us very proud in Slovenia is a sustainable involvement of new young people in youth organizations that advocate for healthy policies and empower other young people through peer-to-peer approach. They were behind all important advancements in our tobacco control policies and have received many international awards for what they do. Based on their experience and good practice, they have created Youth for Health organization that is now an important global player with more than 60 members from around the globe and are taking part also in Youth Council of WHO. Based on our experiences, we now know that engaging communities, civil society, and in particular youth in health policy cycle fosters trust and empowers communities and individuals to take ownership of their own health. Together with Thailand, that is also an excellent example of social participation, and supported by many other countries, we have tabled a resolution on social participation which will be considered tomorrow. I thank you all for your support to agree on the text of resolution and look forward to working with all of you in ensuring successful implementation. WHO we see as the most appropriate platform to share our experiences and develop tools needed to progress best in this area. Thank you very much.
Thank you.
We would like to thank Honorable Minister of Slovenia for her remarks, for sharing experiences from her country and how they were able to involve communities in the interest of advancing health. Thank you so much, Honorable Minister. And thank you for taking the time to be with us this evening and for championing this critical agenda. We know how busy Geneva is these days, so thank you for being here. I would like now to introduce the Excellency Usana Berananda, Ambassador and Permanent Representative of Thailand to the United Nations. You have the floor.
Thank you very much. Thank you.
Yeah,
Oh,
keep
going
going.
that. You may not see me, but I hope my voice can be heard.
Sorry. Go ahead.
Yes, thank you. And good evening, everyone. The honorable ministers, excellencies, distinguished participants, colleagues from the civil society organization. Oh, now my voice is stuttered. Okay, colleagues from the civil society organization, Dr. Bruce, and representative of the youth and all friends who gather here today. Thank you very much, and it is my pleasure to be here with you this evening. I would like to express my sincere appreciation to the co-facilitator, Slovenia, for the excellent partnership. I also would like to thank the core group and the co-sponsor countries for your support of the draft resolution on social participation for the UHC health and well-being. Those of you who attended the opening ceremony of the WHA77 yesterday may have heard what our Prime Minister mentioned. I would like to echo what he said. He quoted from the former UN Secretary General Ban Ki-moon statement that when Thailand started our UHC, it was when our per capita income was merely, $400 US. So UHC is not about money, but it's about commitment of the whole of society to achieve health for all. So I think it's the commitment, and that is why social participation is really important in this process. And for Thailand, we have first-hand experience how social participation can help us get through the public health challenges during COVID-19. We do not leave the task of addressing public health challenges to health workers alone, but the health volunteer, the local communities gather together, work together, and do whatever they can to ensure that people in the society can go through that challenges together. So it's with that spirit that we and the like-minded countries, and particularly Slovenia, come up with the draft resolution. With that spirit, the resolution was crafted to help promote social participation and that contribution to the public health. So it is not just that. We have a very good draft resolution, but what is more important is how can we translate that beautifully crafted languages into real action. And those of you who attend the Walk the Talk event organized by the WHO on Sunday, I think we can also walk this talk together and help ensure that all those commitments reflected in the draft resolution will be fully implemented. And with that, I hope that we can help ensure the concrete action that will promote health for all, and people in this world will be more resilient and safer from the future public health challenges. Thank you very much.
Thank you very much, Your Excellency, Ambassador and Permanent Representative of Thailand to the United Nations, for your remarks.
Hold it.
I'll not be able to.
Sorry, they're fixing issue. Well, I'll just hold it. Sorry.
Thank you. I apologize. So once again, I would like to thank Slovenia and Thailand, the co-facilitators, for their tireless efforts and leadership on the draft resolution. We, UHC 2030, stand ready. We stand ready to work with member states and all stakeholders in implementing the resolution once it is passed. Like you stressed, it is good to have a resolution. The most important is to have it implemented. So we are now going to listen to the last speaker of this segment, and it gives me great pleasure to invite Dr. Bruce Aylward, WHO Assistant Director General of the Universal Health Coverage Life Course Division, an enthusiast, inspiring, and leader for universal health coverage. Bruce, it is a pleasure to give you the floor.
Thank you very much, Magna. I'm being accosted here by the woman with the microphones. Okay, does that work better? Can I be heard in the back? Sort of? Who cares? No, we need the mic. Okay. We need this mic or this mic? Both mics. Okay. Folks, good news and bad news. The good news, probably, is that as I was coming up here, I had a wonderful speech with apologies to my staff who actually wrote this. But the good news is Vesna took it away from me as I was coming up here and said, don't use a speech, speak from the heart. Now, the bad news is I have a pretty big heart, and sometimes I can run on a little bit long. So Vesna, sorry for that, but we'll try and stick to time. Folks, first of all, thanks everybody for coming tonight, and a special thanks, an incredible thanks to Thailand and to Slovenia and the co-sponsors, and I want to tell you why. Today at 12 o'clock, something super important happened. Anyone know what it was? GBW 14, right? Thank you very much. We passed the strategy for global health for the next 4 years. Sorry, it's been the center of my life for the last years. I've been the pen holder on the damn thing. So that is a huge achievement. But well, that credit goes to a lot of other people, like my regional director, Yarbas, and his team, who helped make this, bring this to life. But when we're listening to the comments of the member states, and 60 member states and civil society organizations and others took the floor, and two things kept recurring again and again. One was a huge appreciation for the big consultative process. I mean, it's a miracle we can still speak, because we did speak to everyone, and thank you for so many of you who joined in that conversation. But the second thing we heard again and again was, it is so ambitious. What a great ambition, a giant ambition. And what that usually means is good luck with that. And that's what makes tomorrow's resolution so important, because we, WHO, our 194 member states, we cannot do it even with our UN partners and our other health organization partners like Gavi, the Global Funds, etc. We need civil society, but most importantly, we need the people with us. We need social participation. And this is why just a huge thanks again to Thailand, to Slovenia, for your leadership in driving this through. It was not everybody said by the way, when they said, we want a resolution on social participation, not everyone said, yes, that's a great idea. It took, 8 months, 9 months to get us. Now everyone believes it's a great idea, and you'll hear that tomorrow. So huge thank you, and thank you to the co-sponsors who've also joined in on this, because this is nothing less than a real paradigm shift, right? And I mean, this is dangerous territory we're getting into with this resolution, because we're starting to talk about power imbalances and trying to tackle those and give a voice to the people, which is absolutely crucial, right? To empower those voices, to make sure that we, in positions like mine, are and the ministers and the ambassadors, and to Magda now and Pamela, our co-chairs of UHC, to make sure that we're responding to the right needs, right? You gotta listen to the people if that's gonna happen. And as you look forward, so important to building and fostering trust. We cannot create health and well-being, as we saw in COVID-19, without that trust. Now, That requires, though, when you start talking about power imbalances, you have to start looking at how the heck do you do that, because it's not going to happen by accident. You got to put mechanisms in place, and you got to figure out how to make it work. And I think, as we've heard from some of the others, it's not easy. And that's why I think our co-sponsors and our co-chairs of this process are so credible. Thailand, with, what is it now, 15 years of experience with national health assemblies, I believe they're called, that bring the people's voice into setting their processes. We heard from Minister Valentina about the health promotion centers that are linked in the government now and so important. In Brazil, surely Brazil's here. I think, Jarbas, we have someone else beside you from Brazil, of course. And Brazil now with your, if I'm... yeah, there's always a bunch of Brazilians. If you're in Geneva, if you're in a bar, say Brazil and you're going to find a bunch of them. Right, we just proved it again. But, you know, with Brazil, and if I've got it right, it's the National Health Council that you've put in place now. And then in France, I think Antoine is here, we've got the National Health Conferences. And in Norway, one of the most difficult things, as always, not only is the language difficult, but then when they put it in English, it's also difficult. But if I remember correctly, in Norway, it is the National Association for Peer Workers, if I remember, got the tone right. And in Tunisia, our other co-sponsors, of course, we have citizen juries to help take this agenda forward. So a lot of experience, a lot of mechanisms that have proved this can actually work when the political will and the will of the people come together. Now, last comment I want to make, promise the last one, Vesna, is about walk the talk. And I think Magda or Ambassador, you mentioned the walk the talk. WHO is walking the talk in this area. It took us a little bit of time, but now we do have a youth council. We do have a civil society commission. I think we've got Ines and Elena are going to say a few words today. Great. But so we're trying to walk the talk, not quite where we need to get to, but we're starting at least to engage properly. We are also putting out that normative technical guidance, our job, and we put together the handbook from a couple of years ago, additional technical guidance. We'll continue to do that. Most importantly, we've got people out there in 120 countries that are actually working to take this agenda forward, our policy advisors. So we're trying to walk the talk on social participation. We won't do enough, and we won't do enough fast enough, but our heart is in the right place, and a lot of the reason it's there is because of Thailand and Slovenia who championed this agenda. So thank you very much for that. Thank you all for coming tonight. Thank you for Demora for a big round of applause when we get that social participation resolution through, because it truly marks a real shift in how we are going to deliver health and well-being. And most importantly, that GPW 14, which is one heavy piece of work in front of us. But it's a good thing to be doing. So thank you all, and thank you to our host for this evening. Magda.
region and globally is committed to establishing sustainable frameworks for social participation in health. Our Minister's Health Participatory Governance Committee is actively shaping a national strategy in collaboration with civil society representatives to create a healthcare system that really reflects the needs and voice of the Tunisian people. Thank you. See you.
Thank you, Honorable Minister of Health of Tunisia, for your remarks and for sponsoring the resolution on social participation. It is now my great pleasure to invite the Secretary General from the Ministry of Health and Care Services of Norway. Also Norway, one of the sponsors of the resolution. I would like to invite Ms. Catherine Marie Loftus to take the floor for her remarks.
Thank you. I'll hold it next to you.
Okay, thank you. I got the same message from Vesna as Bruce. You have to get rid of all your papers and just talk from your heart. So Vesna, Slovenia, Thailand, thank you for this initiative. I think it's extremely important, and I think everyone agree that social participation and fair decision making is extremely important when it comes to advance universal health coverage and better health for all, and for building public trust. And we have all been experienced this pandemic now, and the public trust is so important when it comes to dealing with health crisis. So we really believe in social participation. We have a legal framework, we have systems, and we have financial mechanism for social participation in Norway. We have user councils at the ministry, and we have user councils at the hospitals, and we have public hearings at the communities. But I think we have to do better in primary health care. And last year we established 3 commissions that have been working on prioritization in health, and now we have the reports, so we are working with all the recommendations. And then we really want to learn from all of you here. So we are looking forward to further cooperation and to tomorrow when the resolution is adopted. Thank you, everybody.
Thank you all for your remarks, your patience, and your support until now. It is my great pleasure to invite Joseph Figueres from the European Observatory of Health Systems and Policies, who will moderate the next session. I take leave from you. Thank you very much.
Thank you very much. Well, thank you, and thank you for being here. I'm sorry you're crowded and all that, so we'll make it as entertaining as possible. I've been asked to be the devil's advocate, okay? So I'm going to disagree with social participation. I'm sure you're all going to wake up now. I'm going to disagree. I'm going to invite the 2 colleagues I've been very much behind, as well as many other people, into this Eurohealth. I hope you all taken a copy. It's still a paper copy, I'm sorry. We're a bit old-fashioned, but we believe that you can read it in the plane and so on. So take a copy of the Zero Health, which is the latest evidence which is being brought together to support this resolution. Okay? So let me invite Deepa Rajan, working in the observatory. My name is Joseph Figueras. I work for the observatory, and disclose as well that they're gonna talk about this. Kira Koch and Deepa Rajan are gonna talk about this wonderful paper. So, what is social participation? Why really? I know it's politically correct to say, yes, we want the population to participate. Good for votes, it's very useful, but why? What are the benefits? And if you convince me on the first two, you have to tell me how you do that. Okay? So let's start with the what. Deepa, I look at the table here. Box 2. Box 2 has public engagement, participation, public consultation, deliberative processes, public deliberation, citizen participation, citizen engagement, committee engagement, patient engagement, participatory governance, and social participation. I don't understand. I don't get it. Is it all the same? Is it different? Why are we confusing our member states with so much terminology? I am confused, and I meant to be working this field. Okay? Okay.
Okay, well, what is it? Well, first of all, we need to talk about the who. Who are we talking about here? So all of those terms basically cover the who. We cover people. This is what it's about. It's about people, it's about communities, and it's about civil society. People, what do we mean by that? It means lay people, it means residents, it means citizens. Then we use the term communities. Why? Because in health we tend to engage with particular communities because we want to improve their health outcomes. Indigenous communities, people living with HIV/AIDS. Then we have civil society because these are people who are organized around a certain idea, a community, and belief, etc. So it's important that we have all three of them. People and communities and civil society involved. Now the term, what is it? Social participation. Why social? It's because we want social, we put that very deliberately before the word participation. When we did the WHO handbook on social participation, we did an overview of terms, and we saw that this is what we landed on, because social basically means everyone of society, everyone, people, lay people, those who are organized, those who are not, those who are patients, those who are not, everyone.
So do I need to stop talking about citizen participation, citizen engagement? All is gone now. It's all social participation.
We include citizens, but we go beyond citizens. We want people who are residents and who may not be citizens, like you living in Belgium.
Okay, Kira, we need to go fast because people are tired. Kira, tell me, but not give me a long shopping list. Give me two characteristics so I understand social participation. I kind of get it, but what are 2 or 3 things that really are behind this concept?
Okay, Joseph, I give you 3. I'm negotiating a little bit. There are 7 if you see the Eurohealth up there in the chapter 1. But my first one is, when we talk about social participation, we talk about a 2-way dialogue. What do I mean with that? It's not the one-way communication. There's a vaccination campaign. You should all go there. It's that dialogue. If we are interacting, if we are deliberating, it's this understanding, sharing experiences, sharing our information, our daily challenges in order to then iteratively come up with a common understanding and common solution how we can actually address our health challenges. The second one I want to make sure is it's the link to the policy uptake. And that's actually tricky because we have a lot of participatory processes out here. But often the challenge is actually how we can link and use all of these great information and recommendation in order to have them adequately linked to policy uptake and decision making. So actually there is more responsive policies, more responsive strategies, more responsive programs that then improve health outcome and advance equity. And my last point, because I really like to talk about equity, it's about the inclusive participation. So Deepa, you've already mentioned about it. We need to include social. Social participation means inclusive participation, but that also means the targeted efforts to include vulnerable and marginalized population groups, those who don't have a voice that much who are often left behind. And for those, in order to reach them, it's for governments also to do that additional efforts, to go to the communities, to translate, provide translation, advance public health literacy, etc. So there's a lot more out there, but here you have a couple of points for you to consider. Thank you.
Well, that's not genuine. That's not genuine. Hold on. You applaud me. Okay. Let's say that in terms of principle, we want to do that. It's a matter of democracy. It's a matter of society. I buy that. But yes, UHC, of course, we're all behind UHC. UHC is sponsoring that. No, seriously, of course. But I want more concrete things. What are the why? What are the kinds of value propositions, the benefits, real benefits? We have ministers here in the room that I convince them that if they adopt these mechanisms, which takes energy and resources, we know one value, of course, is politically correct. It's attractive, we involve the population, we do consultation. It happens very often in many meetings. You'll agree with me, Milka. We start the meeting, I'll let you speak later. We start the meeting, and at the end someone says, oh, the patients, participation, civil society. Everyone agrees, and we go home. Another meeting, I'm trying to provoke you a tiny bit, but what we want to hear now, seriously, is because we do have the evidence here, and we heard from your Minister Vesna very clear examples of the benefits of social participation. In which way we get these benefits? What are the benefits? Give us particular examples.
Thanks, Joseph, and maybe I would start first. I give you two words and I will explain in more detail. The first one is trust, and the second one is resilience. Now, we have seen over the past years that the world has faced unprecedented challenges. We have gone through the COVID-19 inequities, increased conflicts. So what have we also learned during COVID-19? That there has been that wake-up call. It's crucial that we are engaging with people, communities, and civil society to better understand their lived experiences. Imagine we had the vaccination. How can you go to the communities, convince, maybe potentially raise some of the concerns, have that dialogue in order to increase vaccine uptake, for example. But we also understood that trust is not something that we can build overnight. It's something that takes time. It's about identifying who we need to engage with, who are our civil society community representatives who can go into the communities, who can convince, who can have that dialogue, who can erase some of the concerns in order to then build up. But this is important in order to have social participation being invested now, so it can have those relations that are built, the platforms that have been established in order to use them when the next pandemic is around. And my second point quickly on this is also because we talk a lot about resilience. How can we actually build back better? How can we improve and build resilient health systems that they are more agile in order to have them be prepared for the new challenges coming up? And here again, it's about listening, it's about engaging with people and communities in order to better prepare, in order to build those health systems that we need to make them more people-centered. And I'm sure Deepa actually has some more. So I will pass it directly over to her.
Okay, I'll give you a concrete example. We heard from the Minister of Health of Slovenia, from Valentina in Slovenia, and Vesna, this is a story I heard from Vesna several times. Health promotion centers that were set up in the communities in order to really reach out to communities and provide preventive and promotive services, especially to marginalized and vulnerable communities. They were set up, but they weren't coming into those health facilities. They were wondering what's going on, and basically what they realized is that they didn't really know how to access these communities. These communities were facing barriers to access. So what happened? The government decided to partner with NGOs who work with the communities, who reach out to the communities. And by partnering with the NGOs, suddenly the utilization rates have gone up in these health promotion centers. These people are accessing services. There's a better understanding amongst health workers what the needs are of these communities, so services have been adapted. And so health outcomes have improved. So this is a very concrete example. Without that engagement of communities, we cannot have better health outcomes.
So indeed, these are the pathways to achieve universal health coverage. It's indeed the way, accessing to the vulnerable populations, creating trust. Trust is one of the values, is one of the principles that has major impact then in access, in quality, in utilization of services. And perhaps we should add another one, transparency and accountability. Sometimes in WHO, we find that when member states change, ministries change, there's no memory. And it's the NGOs there reminding member states of the agreements they made with international organizations like WHO, international treaties. So that element of transparency and accountability in some societies is very important. But briefly, because we are out of our 15 minutes, let's go to the how. How? How in two ways. What kinds of mechanisms we have to achieve that? Again, the book, the study, the EuroHealth, tells you a large number of ways to do it, from focus groups, engagement methods, public hearings, consultations by invitation like policy dialogues, open for all forums, and so on and so on and so forth. So there are two aspects of the how. One, maybe first with you, Deepa, what kinds of mechanisms are there? What are the ones that work the best? And I know there's no one best, and here are many. And then I'd like to you in another how. Kira.
Okay, so there's a lot of mechanisms. You can read all about it in the EuroHealth. I won't go into them in detail. The important thing is each mechanism, let's say online mechanisms, you reach some people, some communities, but you don't reach others. For example, online you reach youth, you might reach people who are tech savvy, but you don't reach others, and marginalized communities you may not reach. So the message I'd like to give you is that each mechanism has its pros and cons, and countries that are serious about social participation will use a mix of the different methods in order to really reach the maximum population and maximum communities, and you should always analyze who you are not reaching, because there's always somebody who's left behind, and then you need targeted mechanisms to reach those groups. That's the main message that we'd like to give here.
So we hope that with all that you get incentive to read the EuroHealth and those very specific practical examples. But Kira, there's another how. The other how is how do we steer, govern, institutionalize. With Minister Garcia, we were just talking a minute ago about it depends on different ministries, but how do you institutionalize that? How do you finance that? Because some civil society is very much linked to funds by the private sector, sometimes with very specific vested interests. How do we get an independent civil society, social participation? How do we finance them? In many countries, civil servants are rather afraid of civil society sometimes because of transparency and accountability. How do we deal with all that? Not an easy answer.
Yeah, you give me 1 minute, which is basically impossible. But here, let me give you 2 points. The first one is on the how. Yes, of course, and please do read through. There's a lot of the how when we want to think through representation, when we want to think through capacities, when we want to think through policy update, but also how we want to sustain it. Because of course, there are many ad hoc initiatives. We've seen them a lot in the COVID-19 pandemic. It's good to try. Let's try it out. But often these are one-off initiatives. So how can we actually move from these ad hoc one-off initiatives to have regular and sustained engagement? And I will use the great example from Thailand. In Thailand, you have the National Health Act in 2007. And this was really the mandate in order to establish the National Health Assemblies. There was a National Health Commission Office created with many 80+ staff who are working on it, who are capacitated, who have the financing as well. And what is also important, a lot of financing over the decade has also gone into capacity building of civil society. So it's not civil society coming in order to complain, it's civil society coming in order to provide solution, engage with them, equally recognized as partners in order to develop policy relevant solution. And that's important because of course, when you mention financing, the transparency, accountability, it's managing power imbalances and managing conflict of interest. So I may leave you with that. Thank you, Joseph.
Thank you very much. Thank you to them, thank you to the team at the Observatory, and the team in particularly in headquarters who's been leading all this work. And thank you also to Vesna Petric, who's going to come in a minute, who's been very much the engine behind that, and Nanut Maturapote as well from Thailand, the two sponsor countries that have been very much behind. And if we manage, by me being a bit silly, and by them giving very great responses, for you to look at it, will be be very, very, very happy. Thank you. That's much.
Okay, how many of you would want to sit down? Good. How many of you would want to drink or eat something? I see. None of this will happen. So here we go. Some of you know me. I'm the former EB chair. I am known for being strict, and I will now call the Minister of Brazil to come on the podium and share her views. And as all the ministers, except mine, she has 1 minute. Brazil, where are you? Minister Isabel? Ah, here you go.
Everyone, but I will speak in Portuguese because a delegação é grande do Brasil, tá certo? Tá.
She says she'll speak Portuguese because our delegation is huge, so we'll speak to our as well.
Gostaria de começar até referindo ao anterior. Um governo verdadeiramente democrático, a gestão está dialogando com a sociedade civil, com os conselhos, como fazemos no Brasil. No Brasil, a construção do SUS e da saúde como direito universal de cidadania é fruto de amplo processo de participação social afirmado na nossa Constituição Federal de 1988.
The creation of the Brazilian Unified Health System and health as a universal right of citizenship is a result of a broad process of social participation which was stated in the Federal Constitution of 1988.
A Constituição do Brasil reconhece a saúde como direito de cidadania e a participação da sociedade na gestão das políticas públicas.
The Brazilian Constitution recognizes health as a citizen's right and the participation of society in the management of public policies as well.
O controle social constitui uma das maiores conquistas do processo de construção do sistema de saúde brasileiro ao longo dos últimos 35 anos e tem contribuído para a ampliação da participação dos diversos atores sociais e políticos na tomada de decisões, bem como no monitoramento e avaliação das políticas de saúde.
Social control is one of the greatest achievements in the constitution of the Brazilian health system over the past 35 years. And it has contributed to the increased participation of various social and political actors in the decision-making, as well as the monitoring and evaluation of health policies.
A gestão participativa, inclusive, de formulação de propostas avançadas, constitui-se também em momentos de adversidade, em locos de resistência, como enfrentamos durante a pandemia no Brasil, com um trabalho intenso de comunidades, de movimentos sociais, de estados e municípios.
And this very spirit of the creation of the so-called participatory management creates also moments of discussions, of even arguments as it happened during the COVID-19 pandemic with the communities.
A democracia produz espaços de diálogo, de ideias, de propostas e é fundamental estimular estratégias que fortaleçam a gestão participativa e isso nós esperamos com essa resolução, ampliar essa gestão para vários países, para nos constituirmos de forma global como uma fortaleza.
Social participation is essential for the consolidation of democracy and definitely something that we expect to bring to other countries for us to be strength not only as one country but as a community, as all the countries.
O caminho proposto passa necessariamente pela implementação de ações que de fato fortaleçam a equidade, a valorização das trabalhadoras e trabalhadores da saúde, a gestão democrática das relações de trabalho, a afirmação da educação em saúde como experiência transformadora nas relações de trabalho dos sistemas de saúde. As instâncias, portanto, de participação social no Brasil constituem um espaço importante de discussão em torno das políticas voltadas à expansão do acesso à população, às intervenções, os serviços de saúde, tendo em vista o reconhecimento das diferenças e singularidades que caracterizam a população brasileira e o oferecimento de ações pertinentes às suas necessidades. A valorização e o respeito às diferenças étnicas, regionais, socioculturais, de orientação sexual e de gênero são fundamentais para as nossas propostas a serem implementadas a nível de políticas estruturantes governamentais.
So the social participation bodies in Brazil provide an important forum for discussing policies aimed at expanding the population's access to health actions and services with a view to the universality of care, comprehensiveness of care, and equity. That means recognizing the differences and singularities that characterize the Brazilian population and offering health actions that are pertinent and appropriate to the needs of different groups according to their particularities and singularities. That means valuing and respecting ethnic, regional, social, cultural, sexual orientation, and gender differences, which are fundamental to ensuring that the government health promotion actions be consistent with the population's reality, considering their needs, demands, values, and social practices.
Precisamos estar atentos às inter-relações entre sistemas naturais e sociais. O aprofundamento da democracia é fundamental para enfrentar o que nós vamos ter pela frente em relação às emergências sanitárias para, portanto, o futuro da humanidade.
So this kind of action is important for us to, well, not only understand what we have, but also to be able to face the other pandemics and whatever healthy challenges we have in the future.
Temos, portanto, uma grande responsabilidade, nós todos, que é o futuro da humanidade que está em jogo. Portanto, precisamos nos unir na solidariedade e na cooperação, articulando as ações para fortalecer a saúde da democracia e, portanto, garantir a democracia da saúde. Thank you very much.
In sum, we need to work together for now and for the future for us to have the democracy of health. Thank you so much.
Thank you, Brazil. It was rather long, but Brazil is a big country, so we forgive them. They're really big. And also, we are there with you, Brazil, because you have these floods now, so we do understand you have a lot to say and it's appropriate. But now, from now on, everybody longer than 1 minute, I will stop them speaking, I promise you. So now I have here someone really important. Why do we want social participation? Do you know? Because we didn't proceed with UHC as we wanted. So here is a person, Walumbe. Walumbe, come here. I don't know where you are. Here, you are the person. And she's going to say something on the mechanism, civil society engagement. And Walumbe, please be short. Less is better. Less is much better.
Thank you. I needed a microphone. So good evening. Good evening. Good evening. Right at the back. Good evening.
So she's the moderator.
Hello.
And
so yes, my name is Dr. Respa Lumba, and it's an absolute pleasure to be in this room. I started
She was supposed to be here.
no, because these are people from before that I have, and this the person now is Kyrgyzstan, and then it's you, then it's Spain.
We have to leave. That's what my concern is, that we have to leave without speaking.
Can you speak? I know you are the last.
Hi Hans, how are you?
No, can you ask where is Kyrgyzstan? I cannot. Spain is not better than Kyrgyzstan. Sorry, I cannot. What can I do?
Is he the one talking?
No, it's Kyrgyzstan, and Kyrgyzstan has to leave too. So
the RD is asking.
Yeah.
across the world, in all of the countries, from health financing reforms in Kenya.
So you obviously Hans will help you, and so you come in now.
that communities
Spain.
are put at
So
the
she's
heart
speaking next?
of this
Monica
process.
is
I don't
speaking
know.
next?
Because when communities are put at the heart of the process, you won't have disengagement, you won't have apathy, you won't have people disengaging with your process and completely being disenfranchised from all the things that we're hoping to do here. This resolution matters not just for us to pass it. It's not what's important on the streets of Geneva. It's important in the streets of Rio. It's important in the streets of Nairobi. It's across the world. This is a global process. And it matters because everyone in this room, by virtue of being here, you are a champion for the people who could not be here. And I think that's something that we often forget. You stand here as a champion for social participation, for those people who have been begging to say what they wanted to say, what they needed to say, on behalf of their even larger communities. So all I wanted to do is just to say thank you. Thank you for being here. Thank you for standing with the resolution. Thank you for pushing this process, because while we have a very complicated world that continues to change, the only way we can change it for the better is if we do it together. And so, as I finalize, before I'm chased off the stage, it's to say, there's a proverb I love to say, and it's, if you want to go fast, does anyone know it? Thank you. If you want to go fast, you go. But if you want to go far, you go. Thank you.
Thank you so much. This is good. There is a long line of ministers. I'm totally desperate. But we will have a minister of Spain now. And she really promised me to be super short. Super short. With the microphone, more short. With the microphone. Bravo! Okay. We have a theme in Spain. The good thing is brief. Twice good. So I will be brief. So, thank you, the Director General and the proposing states, for drafting this important resolution on social participation. This resolution reflects our shared commitment to health as a fundamental right, human right, and acknowledge the importance of social participation in building inclusive, equitable, and sustainable health systems. We are pleased to see principles that Spain firmly upholds reflected to this text. Spain wants to emphasize or conviction that social participation is essential for achieving universal health coverage and promoting health. In Spain, we're working on recover the universality law lost in 2012, and we are real access to the health system for all, health for all, and all for health. So Spain strongly supports the proposed resolution and is committed to continuing strengthening social participation in health, nationality, and globally. Thank you very much. Thank you, Minister. Great. This was quite short. Now we have, I'm amazed. There are so many ministers. What is it? Everybody wants to be social participation nowadays. And here is another minister from Kyrgyzstan. I give the floor to the Minister of Kyrgyzstan.
Good evening, guests. Кыргызстан поддерживает резолюции, которая была разработана Словенией и Таиландом. У нас в Кыргызстане тоже где в резолюции написано, поддерживаем все данные резолюции. So Kyrgyzstan supports the draft resolution kindly elaborated by the missions in Slovenia and Thailand. I have to note that our national legislation, all the terms and references of the resolution are well noted. Мы поддерживаем опыт Таиланда, который было впервые проведено в Видне, и в ноябре у нас тоже будет проводиться первые ассамблеи медиков, где будут приглашены врачи, будут приглашены сестры и санитарные. We had the opportunity to exchange the views with the colleagues from Thailand on the concept for a national health assembly, and we look forward to developing similar efforts in Kyrgyzstan. So, as an outcome of these efforts, to strengthen the health workforce and empower communities, later this year in my country, a National Health Assembly will commence and bring together key stakeholders.
Всех вас мы приглашаем на проект Кыргызстан и принять участие, где будет тоже большой опыт. Впервые будет проводиться первая ассамблея в Кыргызстане.
So we invite all of you in this November to this National Assembly, which will commence first time in history, and we will be able to exchange the best practices we have. Thank you.
Rahman, thank you.
Minister, this was short, and as you could see, from the heart, no papers, nothing. So thank you so much. Now, the next on my list, and I have glasses here, and I promise that after that, I will invite, who do you think I will invite? Civil society, my goodness, everybody is speaking except them, and we are here for them. So, but now I'm asking Michelle Sumilas from USAID to speak to us, because we know that there is a long experience of working with civil society. So please share with us what you know, but be very, very short.
Okay, I'll keep.
Well, let me just say, I am standing between myself and civil society, so I'm not going to speak long. I want to first of all thank all the member states who have supported this resolution. We are very happy to join you. Last night we did a big event on locally led development, localization, civil society engagement, social participation, engagement with communities, especially those that are most at risk, is very important to USAID. So I want to applaud the leaders of this effort and applaud civil society for who made it happen, and now ask that you double down and actually make all of us do what it says. So thanks so much for tonight. I was quick, right?
This was excellent, madam. How could you do it? Okay, but you know what? I promise, and when I promise, I keep my promise. I know that in this room is an organization, it's called Movendi, is dealing with something so difficult, it's alcohol. Movendi, can you come up and speak to people about what you actually expect from all these people, from governments and WHO, but be very short, please.
Thank you, Vesna. Good evening, everyone. My name is Mike. This is a fantastic conversation, and as I listen to it, I think I would like to add one more dimension, and that is the change we seek in global health and in public health is at the community, is at the grassroots. So what we do as a global social movement in Movendi International, we connect the people at the grassroots to what we are discussing here in Geneva. And what happens then is that the norms that we are establishing here, they become lived reality in the communities. And for that to happen, of course, we also need to invest in communities. Thailand does this very well, investing in social movements. Slovenia does this very well. And so I think that's also an important dimension here. The norms become reality through the community involvement, and through investing in communities, I think we make progress in global health, in public health, and in social justice.
Bravo. Thank you so much. And now, as a response to what has been said, I'm inviting France, Antoine Saint-Denis. Please come up and maybe refer to what has just been said. How is France doing in social participation?
Thank you very much. I intend to keep it very brief, but please, I have a request. Please don't consider my heart is less big than the previous speakers. Well, in fact, I've come from France with 3 points: a fact, a conviction, and an example. The fact is, we should remember where we are coming from. We are coming from the 20th century, where medical authority was very high, where we had the pretension to base treatments on science and on technology. But we know and we realize now what we have been missing with this. So I think that from this fact, we can get the conviction that this century should be the century of social participation, not because it's a cherry on the cake, but because it's absolutely needed for patients, for us individually, for us collectively, so that we can better organize and better overcome the many difficulties our healthcare systems are facing, and also because it's a fundamental democratic issue. And there I come to my third point, which is the example. Yesterday in France, and in fact that's the reason why my minister could not participate today. Yesterday in France in the parliament we started the discussion about a law related to the end of life, because health is about death also and about end of life. There are exceptional great expectations from the society, and as you can imagine it's a very tricky issue in France too. And the way the government decided to proceed was not last winter but the winter before, to organize a citizens conference. A citizens conference by 184 citizens, randomly selected, trained thanks to expert events, and in charge of debating a number of principles, political and policy choices, and also how to proceed with the different actors in place. So this so far has made it possible for the public debate in France to be as quiet as possible, so that the different sensibilities, the different stakeholders could not yet agree on something in the parliament, but at least to make this discussion in the parliament possible. So I invite you all to have a look at this, not only at the light of the results and the democratic choices in France, but also in terms of process, because we really consider it that without this it would not have been possible to start the discussion in the parliament in a peaceful way yesterday. Thank you very much indeed.
Thank you so much. I'm really impressed by you people. It must be because you are standing and not eating and drinking that you are becoming shorter and shorter. So how are we going to know that we are doing the right thing? I think research should help us. And here I have Social Participation for Health, Engagement, Research and Empowerment, SPEAR. You are the person, sorry. Here you go. Tell us, how can research help us so that we will have trust in what we do?
Thank you. Good evening. I think we, for the SPHERE project, we work on research on social participation, but here I'm talking about leave no one behind. I was standing from the beginning up to now, I don't really hear the term leave no one behind. That is wrong. That is wrong. You agree with me? Sustainable Development Goal is about leave no one behind. UHC is about leave no one behind. And it is written in the UN document that we need to reach the furthest behind first, but now we need to walk the talk. So when you are talking about social participation, Minister, distinguished guests, make sure that you check on the box. The people who are stigmatized, the people who are hidden, the people who are locked up, the non-citizen, the people who cannot speak or don't speak the language, the people who cannot walk or don't have transportation, the people who are so poor that cannot afford to stop working half a day to go to the hospital for their own health. Make sure that these people participate to build the policy and to monitor the program. I still have one more point to pledge to you. When we talk about UHC, very often we are very proud. The country will say 90%, 95%, 98% of our population is covered by UHC. Please check your denominator. Check your denominator. Make sure that your denominator include everyone and leave no one behind. Leave no one behind, please. Thank you.
Leave no one Every time, this is what we are all after. I think some people did say this before, but we should monitor if that is the truth. If we really do not, just talking is not good enough, we all know. But here I have two important people from WHO. One is from Sierra and one is from PAHO. I invite PAHO first to come on up and, oh, he knows already he has to be short. I'm not worried here. Here you go.
Thank you.
Okay. No, thank you. The question for us is how can we support the countries? And I think that our main role as the Pan-American Health Organization and the WHO Regional of South America will be to implement this very important resolution that will be approved in this World Health Assembly. We need really to translate this resolution. We can support the countries working in every country with the Ministry of Health, but also with civil society organizations to share the best practice that we have in our region. In our region, in the Americas, we have countries like Brazil that was here represented by the Vice Minister, that the social participation starts in the establishment of the priorities and go beyond all the cycle of the national health system. We have other countries in the region that the communities were crucial to identify the barriers. Because in the Americas, we like to have the access to the universal health coverage concept. Because in many countries, the people, they have the right to have access to the health service. But when we go to the real indicators, you can identify that many populational groups, due to economic barriers, social barriers, cultural barriers, indigenous people that don't understand the language, that don't feel respected when they go to a health center. These are invisible barriers that can only be identified, and we can only establish proper strategy to overcome them if we have social participation. So I think that from our point of view is to share these good practices, is to work together with the government and with the civil society to have the social participation as a reality in every country in the Americas and for sure in every country in the world. Thank you and congratulations to the countries that are proposing this crucial resolution.
This is exactly what it is. There's a lot of social participation already, but we have to increase it and strengthen it. That is what we are doing here. I have all the regions here. I'm so proud. Sierra, maybe not the old, really old. Sierra, where's the representative? Please.
สวัสดีครับ Good evening. Okay, you have listened to so many things, so I will tell you a bedtime story. Are you familiar with health inequity, difference in health outcome across society? I'm talking about one state in India. This state has 7 times lower infant mortality rate than the national, 4 times for under 5 mortality rate, 3 times for maternal mortality rate. This figure make this state equivalent to high-income country in terms of health outcome. I'm talking about Kerala. You may question, is this a rich state? No, it ranked 12 out of 36 states in terms of wealth, but ranked number 1 in health. 30 years ago, Kerala is not different from the other states. Poor health outcome. But in 1990s, the state government decided one thing. That's called People Campaign for Decentralization Planning, which give power to local government, starting from village council, Panchayat in Hindi, giving them power to decide, to plan, and to monitor, and to implement, and give them 35% of health budget to this village council. 30 years after, they add 10 years to the life expectancy to this state. Now, if this Kerala story is a fairy tale, I have a quiz to you. Who is the brave knight? if we can learn something from Kelela and to adopt and adapt to the world, who is the knight in this story? You all. We can do. And what is the SWOT? You know what? In this thing, social participation. Because they use social participation. And lastly, who is the demon we have to fight with? Is that a government? No. It is the hesitance for us to move from principle to action. Thank you very much.
I think the demon is the ignorance, and we are the ones here who do not ignore anything. I have another region here from Emro. Emro, who is representing Emro, please go ahead. And is everyone short?
I do the shortest maybe. Not quite hard, but no, thank you very much. Thank you indeed for this opportunity. So I come from the Eastern Mediterranean region, which you might be hearing a lot about in the news. We have 21 member states beside the occupied Palestinian territory, where I come from. And it is really a very diverse region in terms of the income level, in terms of the culture, in terms of social and economic development between different countries. I will use three key words to reflect on this question of social participation. The first word is what I really feel when I hear the word social participation is culture. I think while we need to think global, we need to act local. We cannot just bring any way of engaging people for community engagement or for social participation from one country and try to impose it on another. So we have to abide to the principles, but we have to be sensitive to the culture of different countries and the way that we want to engage people. And for that matter, we need to build the institutions. This is my second key word. The institutions, we have listened to our minister from Tunisia, how they have engaged into a societal dialogue to inform the health sector reform. We have other examples from Morocco. We have also the example of Iran, where they have established the People Health Assembly, where they have institutionalized the process of social participation. My third and last key word is right. And by that I mean we need to do it in the right way. And I'm saying the right way in the sense that I'm a health economist by training. In economics, we talk about welfare economics. And welfare economics is founded on the principle of having everyone being the best judge of her own welfare. So if we want to bring in the value, if we want to respond to the preferences of people, we have to go back to them, we have to listen to them in order to inform the decision-making process. So thank you again for the opportunity and looking forward to learning from one another.
Thank you very much. We have one region still to speak, but this region is prepared to give the floor to the civil society. So civil society first. WHO Civil Society Commission, is this civil society? No, but WHO Youth Council, it's representing civil society. So Youth Council first, and then the Civil Society Commission. Youth Council, where are you?
Hi everyone, if you can hear me, clap once. If you can hear me, clap twice. Okay, let's go. So we would like to share with you the fact that in our own organized youth organizations, and as Vesna once said, organized youth can change the world, we already have processes that help us engage with all our members. So we actually have capacity building processes, and we manage to involve our youth, in this case of youth organizations, in all of the policy cycle, and they have a really strong voice in what actually our own stances and our own values and positions. And because of this, I call on member states to keep helping us involving every person, every youth. Look at the member states and the countries that actually spoke here today, learn from their positive examples and positive experiences, but also start engaging your youth as youth delegates in your delegations to the World Health Assembly or to other assemblies, because we can be so helpful and we can contribute so much to your delegations. Bring the youth perspective of our own countries, our own communities, our own peers. We can bring them to you. And to finalize, otherwise Vesna will kick me out, I would just like to say, yes, we are the future, and you see us as the future leaders, but we are not just the future. We are here today, we are the present, we are here now, and we have a voice. So thank you very much, and I hope you can engage more in the future.
And now, of course, Civil Society Commission will see how fast she can do it, but it's really, really important body.
Good evening, everyone. Thank you so much for being here. Hello in the back. Good evening. My name is Eliana Monteforte. I'm from the WHO Civil Society Commission. And for those of you who don't know the Commission, the way we explain who we are is we say, while everyone is talking about climate change, which is great, we're talking about culture change. We're talking about changing the culture at WHO so that civil society is not an afterthought, but so that civil society is part of the system and is integrated into the system. And if we want social participation to work in the countries, we at WHO should really be the leaders, and we should really show how civil society can really make a difference and how we can interact with civil society. Social participation, it's not just theory, it's not just rhetoric, it actually saves lives. And there is so much data and research that the SPHERE project, and if you look at the EuroHealth articles, show that it saves lives. So I ask in this call for action that everybody, when you walk out of this great event, that you please do everything you can in your home countries to institutionalize social participation, to finance social participation, and to let civil society represent. Thank you.
You know, we have all these councils all around. There is a Brazil, in Brazil, some council. Where is it? Brazil, Brazil, Brazil? Okay. Brazil was super long, sir. So you just have a few sentences.
Boa noite. Como eu não entendo nada em inglês, eu não sei o que ela falou, então eu vou agora falar o que nós da sociedade civil brasileira, que estamos aqui com um coletivo de quase 30 pessoas, representando não só o Conselho Nacional de Saúde, mas entidades, movimentos, porque nós estamos fazendo dessa Assembleia a nossa Assembleia. Então, aqui a tradução. Eu já ia, ela fica...
I don't understand English, so I'm going to start speaking. We are here with a delegation of about 30 people from the civil society in Brazil, so we are here to make history in this health assembly.
Nós tivemos uma atividade paralela no passado, onde parecia um sonho que nós estaríamos hoje aqui comemorando a aprovação de uma resolução sobre participação social. E eis a realidade, isso é fruto da própria participação social ativa que ajudou a construir essa resolução que vai ser aprovada amanhã.
So, in the last year, we attended a side event here, and we started this process of drafting this resolution, and now we are celebrating the approval of this resolution in this assembly this year.
O nosso maior desafio agora é fazer com que essa resolução seja implementada para garantir de fato que ela não fique só no papel, que ela se torne a possibilidade de as pessoas viverem, porque é isso que faz o participação social, é garantir vida para pessoas como nós fizemos na pandemia da Covid-19.
Implementation. I didn't understand the word, but he was speaking of implementation. I know this.
Our role now is to make this resolution a reality and implement this as we did in the pandemic. This is what social participation is about.
People, I only have 2 people more on my list, but to make it shorter, I'll put them together. Mansa, where are you, Mansa? Mansa, where's Mansa? Mansa, you have now a challenge. You will ask the question because she is representing youth. She's presenting youth in Slovenia. Slovenia is going strong, as my minister has said, and she is going to be a challenge for our regional director, Hans Kluge, who tells me all the time that he loves youth participation. So let's see how they can discuss. They have only 2 minutes less. 1 minute and a half.
Interesting. Okay, first of all, thank you, Vesna. Maybe I need to ask you some interesting questions, I guess. So maybe my question would be, what do you think youth should know
as some of you may know, we started the Youth for Health initiative in Euro. It was born there in Albania, in Tirano. And what you should know is that we did make the mind shift not to involve the youth once that the policy is made, but from the very important start, when things still have to be shaped up.
Okay, so probably from the youth perspective, I guess?
Yes, absolutely. Actually, my own daughter participated at the Budapest Declaration to make the declaration, also in Almaty, at the Almaty Declaration 45th anniversary. So what you should know is that you are serious about this and not sitting in an ivory tower saying some blah blah nonsense, but that it's really about, as a colleague, Madame told, leaving no one behind.
Great, amazing. An applause, please. And I would say, and I need to say something, not only ask questions, I need to say that Vesna here, Vesna Kasti-Petric, is also one of the most important people in Slovenia to really understand why youth, and not only youth, civil society needs to sit next to all of these experts that really do not understand how civil society works. So thank you, Vesna, for that. And also, I want to say that for youth or any other civil society, you need to have people like Vesna in the government or officials, so they understand how you work and how they can bring you closer to the table. So you need to find that one person who will support you, even when you do not know how to talk to politicians. So just another question, maybe?
No, we got you.
Okay, so what do you think the future looks like now that you've heard all of this? Do you think we all can sit together on a table? Do you think that in every assembly there will be young people, or do you think that maybe there is some challenges that we still need to, go through? So this could be in the future still a very big story for all of us.
So thank you. I think both. Last year, for the first time in history, when I sent a letter to the 53 ministers of health to attend our governing board, I included a paragraph, right, Vesna, to encourage them to include a youth person. Not all 53 did, but already a chunk. And for the future, absolutely. I speak from my own experience when I was working 5 years in Myanmar, when there was the military junta. And we had tuberculosis control program. So I couldn't reach the people really in the rural area, in the far. We left many people behind. There was Médecins Sans Frontières, MSF, Doctors Without Borders, with who I worked 5 years, who was ready to serve the people, but they were not allowed. So we were sitting around the table with the young MSF people, with WHO. We had access to the government, they had access to the rural areas, and we saved a lot of lives to leave no one behind in all countries, including Myanmar. Thank you.
Thank you.
Hans, is that all you wanted to say?
I gave you 2 minutes, Sylvester.
Okay, fine.
Yes, okay, last then. If you ask me, I never refuse. So, dear colleagues, I think indeed we should give a 3 times hurrah for someone who is so modest, but who has been suffering her share. If you want to make change in policy, right, you suffer your share. On Dr. Vesna Petric, let's say 3 times hurrah! 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 Hurrah!
Thank you. And now to close down, we have a special person. I will be short. No, I'm not chairing you, so you can do whatever you want.
Okay, thank you so much. So I promised to you that I'm the last speaker, and I have a good news that I will speak short, and I will be short. So that's the good news. 3 things. Number 1, in 1945, the United Nations Charter was constructed, was adopted by the states. In the preamble, the first sentence says, quote, "We, the peoples of the United Nations, determined to," so and so and so. So we need to go back always to that, to the United Nations Charter that said, "We, the peoples." The peoples, to me, in that sentence, in the preamble of the United Nations Charter means the sick and the healthy, the rich and the poor, the young and the old, the urban and the rural, the north and the south, the east and the west. So let's remind ourselves of the United Nations Charter. So many things were spoken in the last almost 2 hours. Social contract for UHC. That's what social participation is about. It's about who controls the resources and who lacks the resources, who have access to services and who do not have access to services, who makes the decision and who are affected by those decisions. So that's what we are talking about. That's what we spoke in the last 1.5 or 2 hours. This was my first point. My second point is about primary health care. I want to uphold that because one of the components of primary health care is community empowerment, communities' engagement, and it has been at the heart of that for social justice, for participation, equity, human rights. And I want to say, somebody said, why you didn't mention people left behind? And I want to say, we should also mention primary health care. And I'm here as the director of the Primary Health Care Special Program with WHO, so I want to raise that flag. My last point is, we see here a celebration, and we deserve that. But I tell you, as a WHO Secretariat, how many hours, days, weeks, and months went into the resolution that's going to be discussed tomorrow? Every word, every term, negotiated, renegotiated, renegotiated, rediscussed bilaterally, multilaterally, etc. So, bravo. Bravo, dear co-chair, Wesna, and bravo, Nanut. You were courageous, consistent, and very determined in this process. I remember how much effort you put into this, and once, many times, when no agreement were reached, they said, oh, we will follow them bilaterally, give us few weeks, we will discuss with them bilaterally, we will find a solution. You found a solution. Tomorrow is the big day, and hope the resolution will be adopted. Thank you so much. Thank you. The history will remember this. So thank you.
Want to speak because she likes to work. I got hundreds of emails from her to get the resolution right. This is the person that was actually coordinating us all with her patience and hard work from morning to night. From Thailand, she accepted that she has to work when Europe is awake. So, hurrah for Nanut also. Thank you. Now you can eat and eat.
Did we just survive that? We did it. We did it. I'll just take this down.